Hi, James. How are you?
Sad and okay. Thank you. Sad.
Yeah, I'm so sorry to hear about your brother's passing.
Thank you. I feel it. I can feel it. I can feel you. I haven't seen you. Haven't seen your face in a long time.
Yes, yes. And for anybody that's listening, it is for me a huge honor and pleasure to be talking to Dr. James Gordon, who is a Harvard graduate doctor specialized in psychiatry, with a bio that I would spend too much time talking about, but he's worked all over the world teaching people how to cope with grief and trauma, and he's taught in universities. He's worked in the White House, and he is one of the pioneers of mind body medicine before it even was a thing. So thank you for spending time today talking to me in the midst of the pain that you must be feeling for your brother.
Yeah. Thank you, Alejandro. You know, I thought about it and I thought, well, it'd be good to talk with you. I realized, we had this discussion coming up, and I thought, well, I think it'll be good because part of what's helpful to me is sharing my grief and feeling the connection with others who are open to what's happening with me. So thank you for being
Yeah.
there.
And how were you coping with the other big thing happening now in terms of the pandemic?
Well, in a way, it was, of course, it's easier when it doesn't come so close. I'm not sure my brother died of coronavirus, although he may well have. Some bit mysterious. I think in a time of noticing all the fears, noticing my concerns, but also wanting on a personal level to connect more deeply with other people, with people who are close to me, and also with people who may not have even been so close, but they come into my mind. So when I knew I was going to be talking to you, I thought, yeah, I do want to talk to him. So it's making me appreciate how important people are in my life, and in a sense, helping me to appreciate everything in my life. The flowers outside my window, the yoga stretch, waking up in the morning and taking a shower, all of it sort of there's a heightened sense of appreciation and a desire to be of help to other people. I mean, obviously I became a doctor to be helpful to other people, but now it's kind of everything is heightened. All my senses are heightened. All my emotions are heightened. And so too is my desire to be useful and helpful to other people. But it's so strange, and I don't know if you're feeling this too, because what I'm used to is being with people, whether it's being with a patient in my office or being in a war zone or being there after a hurricane or an earthquake, and being close to people, reach out and touch to them. So it's a whole new kind of adjustment doing this work at a distance.
Yeah, in my case, my house is like a hub. Everybody comes here, and there's always people staying, and travelers, and even people from the city, and sick friends and family members that come and stay with me, and I guide them through their initial healing journey. And now it's completely empty because I'm in self quarantine. I just came back from a trip, took many flights, so it is a little strange.
So where were you on a trip? Where were you going?
I went to India, to Rishikesh and New Delhi. To Rishikesh, I attended the International Yoga Festival. I was talking.
Aha.
I was talking there about detox and gut health, but also spending time with some incredible people, some enlightened beings, if you will. And it was a great trip.
That's great. I have very fond memories of Rishikesh. I have fond memories of swimming in the Ganges, as a matter of fact.
Yes, this is good. That's great. I've done it too. James,
Yeah,
so
time ago.
in your life has been dedicated, at least in the past 10, 20 years, I don't know, to helping people cope with trauma. And this is a time where there's going to be, if there's not already, great trauma because of the loss of lives, the worry, the loss of financial security for so many, and so many other aspects that just kind of stop our life in the tracks. And I thought that maybe the best use of our time here would be for you to, in your experience, give people a few practical ways of looking at it, and things to do that will help them through this time.
Sure. Well, I think the first thing is to do exactly what you and I are doing now, is to realize that we are experiencing trauma, and not to pretend, oh no, I can, everything's going to be fine. I can get through it. I'm tough. I'm strong. So the first thing is to realize what's happening, and to be open to experiencing all the feelings that are there, the feelings of fear and anger, and also, the other feelings, the feelings of love and affection, whatever's coming up. Trauma gives us that opportunity, and it's also a necessity. It's the first step in dealing with trauma. One of the most difficult things for people who've been traumatized is that they don't realize what's going on. And I'm sure you've seen this lots of times. People come, meet people, or people come into the office and they have all these symptoms, and they have, this fear and the anger, and that they don't understand. And often enough, it's coming from trauma. So it's really important to understand that there is trauma there, and that the things that we're feeling, many of the emotions that we're feeling, many of the thoughts that we're having that seem to us strange or ominous, that they may well have their root in the trauma we're feeling. So that's number one. Number two is we have to, and I know you know this very well, we have to bring ourselves into balance. When we're traumatized, we tend either to go into fight or flight. We're anxious, we're agitated, we can't concentrate, we can't sleep, we're worried about what other people are doing or doing to us. We've got to bring ourselves back into balance. And that's where meditation of any kind becomes so critical. And I think that meditation is the path. I don't know if it's the royal road exactly, but it's perhaps the elegant winding path that will help us move through trauma. And I begin with people, whether it's in person, or we're teaching a training program, or doing a workshop in the middle of a war, or the pages of my book, The Transformation, Discovering Wholeness and Healing After Trauma. I begin with teaching people slow, deep, soft belly breathing. Breathing in through the nose and out through the mouth, with the belly soft and relaxed. Perhaps saying soft as you breathe in, belly as you breathe out. Feeling the relaxation in your belly. Noticing thoughts as they come, letting them come. Letting feelings come, letting them go, and bringing the attention back to the breath and to the words soft as you breathe in, belly as you breathe out. What that does is it is the antidote to the fight or flight response. It begins to establish balance in the body and the mind, what the old physiologists used to call homeostasis, coming into balance. And it makes it possible for us to do all the other things that we can do to help and heal ourselves. All the ways we can mobilize our imagination, our creativity, the ways we can use our physical body to help ourselves. And also it helps us move more easily toward other people. and feel connected to other people who are so important to us when we're going through a traumatic time.
And how much time would you say is the minimum time to do that exercise? I was just doing it, by the way, when you were speaking.
Good. I was too. That's the idea. We need to do it all. Well, I think we should be doing it all the time, really, basically. But when I teach it, I usually teach it initially for about 10 or 12 minutes. And as I teach it, I teach the physiology as well. And people who want to see me doing it on the Center for Mind Body Medicine with me, and it's also, that's the way I teach it in the transformation. But you know, some people can't sit still for 10 or 12 minutes. So if you do it for 3 or 4 or 5 minutes, 2, 3, 4 times a day, that's great. The idea is not a specific meditative technique. There are, as you know, there are thousands of them. These are, the Zen Buddhists say, their fingers pointing at the moon. It's not the technique that we're supposed to fall in love with. It's that moment-to-moment relaxed awareness that the technique can give us. So I suggest to people, do it as much as you can. Do this soft belly breathing whenever you're anxious, whenever you're fearful, whenever you have a confrontation coming up that you don't know how to deal with. Whenever we have a staff meeting at the Center for Mind Body Medicine, we begin and end the meeting with soft belly breathing, just a few minutes, and it helps us let go of whatever is preoccupying us and bring us into the present moment. And when we close the meeting, we close it with another few minutes of soft belly breathing, because it's time to end that meeting and be fresh and present for whatever's happening next. So as often as you can do it, do it.
You've recently published a book about resolving and healing trauma, and I'd like you to tell me a little bit about the book and why you wrote it, and you know, what is it that you're trying to achieve?
Thank you. The book is called The Transformation: Discovering Wholeness and Healing After Trauma. I wrote it because after the previous book I wrote, which was focused on depression, a number of people said to me, well, it's great that you wrote a book on depression. It's really good for people who are depressed. I'm not depressed. Why don't you write a book for me? Why don't you write it? And then other people said, why don't you write a book for everyone? And so I thought about that for a while. I said, well, what is the book I'm going to write for everyone? And I actually started 3 different books and wrote about 50 or 100 pages of each. And then I had a conversation with a very wise man, and he said, well, what do people want to really hear from you about? The other things you want to write about, wellness or telling stories, that's fine. But what is it that people come to you for? What have you been doing with yourself for the last 50 years? I said, well, I've been working with psychological trauma. And he said to me, well, and I said, okay, that's it. And I wrote it because I understand very deeply, as I know you do, that trauma is going to come to all of us sooner or later. If it doesn't come early in life because we were born into poverty or violence, or our parents were abusive or neglectful, it's likely to come in young adulthood or midlife when we have terrible disappointments or losses of romantic relationships, or when our parents become really ill or die. And if it doesn't come then, it will surely come as we grow old and we become frail, and we deal with loss, and we deal with the inevitability of our own death. So I wrote a book about trauma, and I wrote a book to help people understand that trauma is a part of life. It's not apart from life. It's not something that just happens to those other people. It's something that happens to all of us. And that if we can learn to accept it, learn to move through it using the techniques of self-awareness, self-care, self-expression that I've been using for the last 40 or 50 years, if we can move through it, we can not only restore balance and rebuild brains that have been injured by trauma, as the recent research is showing us, but we can also come become more whole, more present, more fulfilled, more loving than we ever have been. And
You know, I walk around and I'm always looking. You know, when I put my doctor's glasses on, and it's difficult for me to take them off. But I see people, and I see how their immune system is working, because if their immune system is inflamed and active, it will protrude because in their belly, because 80% of the immune system is around the belly, right? I see their skin and the puffiness, and I can get a read of the level of toxicity that the people have, right? Now, in terms of trauma, I'm sure you go around and when you talk to people, you see also what trauma or how trauma may be interfering in their life. But a lot of people live without that awareness that trauma is somehow affecting their life, right? Because everybody, well, I move on. And there's this mentality of like move on and get moving, and the past is in the past, and all these things that we say culturally so frequently, right? So, how do you see trauma in people, you know, from your point of view, and also how do people um, realize if there is any trauma that they need to become aware of and release?
those are great questions. I think you see trauma in those behaviors that seem really destructive, self-destructive, perhaps inexplicable, compulsive. You have a feeling when somebody is caught up in the grips of something that's, of course, it's within them, but it feels to them, and it may feel to you like it's beyond them. They can't help doing what they're doing. You know, being angry. You see this often with people with their children. You know, and you know, sometimes I'm aware of sometimes that in myself with my son when I get really angry at something. I think, where is that coming from? Yeah, he's being a pain in the butt, but why am I getting so angry? And I'm realizing that goes back as I reflect on it. And that's the first step, is reflecting on, instead of just assuming that that's the way it is, reflecting on it and noticing, oh, that's my father's anger that's there. And that's the terrible things that his mother did to him that somehow are still living in a slightly mutated form in me, because I'm angry in a way that I have no reason to be. So it's not like, you know, when my son is sticking his head out of the window when he was a kid, when I was driving the car, yes, that's, you know, that's real emergency. But when he's just being difficult, that's not a real emergency. That's not something I have to get so upset about. It's coming from somewhere else. So we need to start becoming aware. And that's why meditation is so important, so that we can become aware. So those thoughts and those understandings will come to us. And with other people, that's really often the first step. And then another way of working that I talk about in the transformation that I've been using now for almost 50 years is doing expressive meditations, which are ways of bringing up emotions and feelings that have often been buried and been locked into the body, like those people you see who are sort of walking around like inflamed beings. Is that when you get them up and get them shaking their bodies and dancing and just sort of moving around and letting go, all of a sudden the anger or the fear or the sadness that's buried in the body, that's manifesting as symptoms of inflammation and increased levels of stress hormones and depressed immunity, that the emotions that are often responsible for those symptoms begin to surface with these expressive meditations. And the one I teach, first of all, the transformation, and again, people can see it on our website, is just shaking your body, standing up and shaking for 5 or 6 minutes, and then pausing for a couple of minutes and just breathing, and then letting the body move to music. What often will come up during the course of that shaking or some of those buried emotions, some of those traumatic memories. And then, I'm sorry, people are calling me every often, so I have to turn off the phone. So that they will surface in the course of that sort of shaking up of these fixed patterns that are coming out as physical symptoms that you see, the tight, held-in bodies that I see, the speech that's strangled in the throat. You know, you talk with people who, their voices are really kind of hoarse and shut down, and often you find that that's a physical expression of a psychological state. I don't feel I have my own voice anymore. So, and sometimes all you have to do, the shaking will bring things up sometimes automatically. Sometimes it's just a matter of asking people to reflect. What do you think is going on? And we know that information is available to us. And a lot of the work I do is with techniques like soft belly breathing, like shaking and dancing, like drawings and guided imagery that help give people access to these emotions that are both responsible for and the result of trauma that live inside us.
Wow, that's it. That's great. Let me ask you, what are you doing for your body? Because mind, body, medicine also is concerned of the body. So in terms of diet and supplement, how are you taking care of yourselves during this time of coronavirus?
What I'm doing, I can't go to the gym. So what I'm doing is I do some of what I've always done, which is I do 20, 30 minutes of stretching every morning, and I pound on my chest for as long as I can and hold my breath while I'm doing it, just to break up whatever tension there is there. And then sometimes I'll put on the music and do the shaking and dancing, the fast rhythmic music, and then pause. I did that earlier today. Pause for a couple of minutes, and then I like reggae, so I put on reggae music and I dance to that just by myself. And then now what I'm doing during this time of the coronavirus is pretty much every evening I spend 20 or 30 minutes doing some salutations, which helps to keep me loose and open up my body. And then I go out and do about 15 minutes of Tai Chi on my porch. I get a little bit of air, and then I do that, and that helps loosen me up and just helps get the energy flowing. And then sometimes if I feel like it while I'm watching something on television, I'll lift some light weights. And I'll do that while I'm sitting there, just to, and a kind of all of it, what it's doing is it's both energizing me and helping me to stay relaxed, and stay in balance. So it's a combination.
And in terms of diet, are you following any guidelines? Are you avoiding any foods? Are you taking any supplements?
Yeah, I'm taking a multivitamin, multi-mineral. I'm taking omega-3s, high doses of omega-3s. I take probiotics. What else am I take turmeric, pretty high doses of turmeric. At night, when I go to sleep, I take CBD oil, and I use some CBD cream on my cranky knees and my back. Those are the main things that I do on a regular. Oh, I take vitamin D3 regularly. I take magnesium as well, in addition to the multivitamin, multi-mineral. I don't take no iron, because I don't need iron. I'm not anemic. I don't want to get too much iron.
In terms of food?
I'm sorry?
In terms of food, are you avoiding any foods? Are you giving...
No, you know what I find, and I don't know if you found this with other people or yourself, I'm craving protein during this time. So I'm paying attention to that. I'm eating much more protein. For example, I do eat more red meat now than ordinarily I almost never have red meat. Now I'm feeling a kind of craving for it. So I have more red meat. I try every once in a while, the comfort foods are calming. They raise.
Are you loading up on some veggies and fruits?
Yeah, sometimes I'll have a but I won't have a lot. I know enough not to have a lot. So I'll have a couple tablespoons of some delicious ice cream, or yeah, that's pretty much.
Well, the word around is that
Chocolate. I'm sorry.
The word around is that, to keep the immune system at its best, it's probably better at this time to avoid, gluten,
Oh yeah, absolutely.
sugar, and dairy, and right. So I'm giving you a heads up. I want you around for a long time.
No, but I think I think you're absolutely right, and my diet's primarily quite a clean and healthy diet, except for the red meat, which promotes inflammation, a little bit of inflammation. I'm sort of willing to sacrifice that right now, but primarily my protein is either vegetable or fish or seafood. But I agree at times want something that's not healthy. Don't punish yourself for it, because punishing yourself is going to be a hell of a lot worse than the piece of chocolate or a few tablespoons of ice cream.
I agree 100%. Doc, it's so good to see you. My heart goes out to you, and I'll be praying for your brother. He's in good company. He's with my papa. So at least there's one good thing about it.
Thank you, Alejandro. I'm looking forward to being with you in person and giving you a big hug. Right now, it's virtual. So
yeah, yes.